That's a two-part question, and I'll go to when should a child have their first dental visit. The American Dental Association recommended 10 years ago, I think, about 10 years ago, that a child should be seen by the time they have their first tooth. Now, I can tell you, most children's first teeth come in when they're 6 months old. So that really shocked a lot of parents. I have to take them to the dentist when they're 6 months old. But I was amazed and open armed about this declaration by the ADA that we should have kids and parents in by the age of 6 months. One, because I enjoy kids, but two, because I couldn't believe how well I was getting the parents to care for the kids at a very young age. I was starting a pattern of education and care that I've seen now, after being a dentist for 25 years, follow through with this patient, and they have no decay. And here they are, 19. One of mine just left, 19 years old. They start coming when they're 5. I'm changing their education from when they're 6 months to when they're 5, or when you thought you should bring a kid in. It used to be, 3 or 4 years old. If we start early, we can really combat a lot of things that cause damage to teeth. One in particular, because I'm a holistic dentist, is breastfeeding. A lot of my patients love to breastfeed for longer periods of time, like until a child is from 3 or 4 or 5. And we can't have milk sitting on the teeth and use that as a soothing mechanism with milk on the teeth. We have to give more of an education on how to care for teeth when they're around milk. And because milk has a sugar in it that can cause decay. And that's okay. We can still breastfeed. There's nothing wrong with that. I love their choice, but I want to teach them how to care for those teeth. And so when you start having teeth, you got to start brushing your teeth. And if you're 6 months old, guess who's going to help you brush? Your mom and dad. And so not only is it an amazing way to help a patient from a very early age get the right habits, but it also gives great education to the 2 adults that are caring for a child. 6 months to a year is usually when they're first coming in. They are still nonverbal. They can say yes and no and mama and dada maybe, but that's about it. So when they see me and I'm coming at them and trying to clean their teeth, they're going to scream. But it's hilarious how they scream bloody murder, and then the second I take my hands off of them, they're like they're happy as a lark again. So the one scary thing for parents is the only way this child can communicate to me is by telling me get off of me, by screaming. But they don't mean it that I'm hurting them. They just mean it like, hey, stop messing with my teeth, I think this is weird. And then you won't believe it, I have a kid that's been coming 6 months, then a year, and then now it's 1.5. They're ready for me to treat their teeth and realize who I am. It's starting off at a very young age to get them used to the provider, but also to realize that once they start talking, they're like, hey, Dr. Katie, they're jumping out of their car and running in here by the time they're 5. So it's just getting used to the family and them getting used to me as a provider, that starting off at a young age is worth it.